Good morning everyone. Welcome to PG Pathshala. I am Dr. Pankaj Tandon from Atomic Energy Regulatory Board, Mumbai. The subject Biophysics and the module on which we are talking today is Principle of Positron Emission Tomography. The objective on which we are going to talk is to understand the principle of photon emission computed tomography, to understand the detection principle of gamma ray emitted from the patient, to know the various type of events detected by the detector and which one is important for formation of image. As the name itself tells about positron emission tomography, it means the positron which is being emitted from the patient is finally going to annihilate with the electron and two photons of 511 keV comes out and we can able to detect the image or the disease from the patient. Second is to understand the detection principle of gamma rays emitted from the patient. Here the principle of detection of the photons which is being emitted from the patient is slightly different than other imaging modalities like SPECT or gamma rays. Then to understand the different types of events which are detected, because here the two photons which are coming from two different directions when 180 degree is definitely some kind of events are going to be missed and some events are useful for the formation of the image. If we really see the little history about the positron, the first existence or the postulated is in 1928 by Paul Dirac. He is the first person who gave us existence of this particular theory, or in 1928 we could able to find what is positron is that. First observed in 1932 by Carl Dirac Anderson, who gave the positron its name. He also suggested to rename the electron to negatron, but he was unsuccessful. So it means the way back in 1928 its existence and the naming given by 1932, but somehow he was not successful in naming the negative electron as negatron. What is positron? We should understand first positron before really going to the principle of positron emission tomography. As the name itself defined, positron means a positive particle or a particle which is having positive energy as compared to electron which is having negative energy. A positron is an antimatter electron. It is identical in mass but has an opposite charges of +1. Positron can come from different number of sources, but for PET they are produced by nuclear decay. Nuclear decay is basically when unstable nucleus are produced in a cyclotron by bombarding the target particle with as proton, and as a result an energy is released and a neutron is coming out and the production of F18 is taken place. What does it mean? It means that for production of positron we require a cyclotron. What does cyclotron does? That we are going to talk in the next few slides. Cyclotron basically energizes the charged particle like proton or deuteron to such a large extent that when it comes in contact with a target, it makes a radionuclide which is a positron emitter. In PET, the target material is chosen so that product of the bombardment decays to a more stable state isotope by emitting positron. For instance, F18 has too many protons in some of, so one of these protons decays into a neutron emitting in the process of positron and a neutrino. It means when a O18 water we takes and when it hits with the proton we get to F18, and this F18 is what isotope which is a positron emitter, and some neutron is being emitted during this particular reaction. After decay, what has happened? We are left with O18. It means we are taking O18 water and bombarding with proton. Finally, production is F18 which is a positron emitter, and this positron emitter is basically used as a radioisotope to be tacked with some compound to make a positron emission radiopharmaceutical. Now this particular slide clearly shows about how the annihilation is taking place and how the two photons are coming out in 180 degree. It is a nature that positron, when hardly moves 1 or 2 millimeter in tissues, it finally interacts with the electron all around it, and all the energy is being, after annihilations, these two photons are coming out. The positron will encounter an electron and completely annihilate each other, resulting in converting all their masses into energy. This is a result of two photons or gamma rays. So whatever energy the positron is having, energy is in MeV range. Finally, after the annihilation, two photons of 511 keV comes out. And what is the objective of the camera is to detect these two photons which are emitted from a particular point. Now because of the conservation of energy and momentum, each photon which is coming out is at 180 degree, and 511 kV is the ideal rest state annihilation value. So this is the way we are going to detect the photons, though the isotope tagged with a compound is a positron. How the positron is produced? It is being produced from an cyclotron, which is a kind of accelerator. Now how to detect these photons? The important thing is, when we talk about a gamma camera or a SPECT, we have two detectors at 180 degree, and the detector has to move all around the patients. But the situation or the mechanism, detection principle is slightly changed in case of PET camera. PET is having gantry, ring of detectors is all around it, patient has to go inside, and finally when injected with the radiopharmaceutical and after annihilation these two photons are coming, it is detected. Now the question arises is how these two photons are detected, and it is possible only when you have detectors all around the patient body or the lesion which you are planning to detect. Because these photons which are coming out, if any of the photons get missed, you may not able to register an event. So here the event registry is very important as far as this principle goes. So when we come to the definition of positron emission tomography, it is again a one of the nuclear imaging technique, because we all know there are many imaging techniques available like CT, like MRI, X-ray conventional, digital X-rays, and when you talk about nuclear medicine, conventional nuclear medicine, gamma camera, SPECT, but this is one of the advanced imaging technology where positron is used. But here we are going to get the images, or you can able to say detect the disease at cellular level. This is also called cellular imaging or a molecular imaging. It is again a non-invasive diagnostic imaging techniques for measuring the metabolic activity of cells in the human body. That is the reason the things which we cannot able to detect at organ level or tissue level, here the chances that you are able to get the same thing at a cellular level. So this is the imaging technologies of today era. If we see the literature and go back when it was developed in mid 1970s. It was the first scanning method to give functional information about the brain. Technology means when the PET is developed, but scanning is the first scanning is being done on the brain where the functional information is collected. So if you see the history of PET scan, usually when it started, the PET scan started late, but the technology came in 1950s or earlier. If you see the concept of emission and transmission tomography, this was introduced by David A. Cole. He was a scientist, the brain behind it, and finally Royal Edwards in the late 1950s at the University of Pennsylvania. So now when we talk about PET, PET is basically positron emission tomography, but the scanning technology or the transmission tomography was first introduced, or the concept of this particular technology was first given by David E. Cole. If you go back in 1970s, Tatsudo Ido at the Brookhaven National Laboratory was the first to describe synthesis of fluoro 18 FDG, the most commonly used PET scanning isotope carrier. Now, if we see the nuclear imaging modalities, where it is a conventional nuclear medicine or a SPECT, where the isotope of choice is technetium-99m. Finally, it is a workhorse, but when we talk about cellular imaging or molecular imaging, the isotope of choice becomes fluorine-18. No doubt, there are other isotopes are available like carbon-11, nitrogen-13, oxygen-15, but fluorine-18 is of choice. The reason behind is because most of the examinations, most of the compound can be coupled with fluorine-18 and about more than 90% of examinations can be done with this. The other important choice, other important reason of choosing this particular fluorine-18 FDG is because it is labeled with fluorodeoxyglucose. Logistic reason, if you see, it is having 110 minutes half-life. It means you can able to send this isotope from a cyclotron which is away from the city to your place and you can able to carry out the scan. But if you see the other positron emitted isotopes like carbon, nitrogen, oxygen, because of short half-lives, it may not be feasible to send it from one place to other place. Now, the fluorodeoxyglucose, we know what does fluorodeoxyglucose does, and we may able to get to know in further few slides about it. Now, there is not one person who developed this PET scan, but a whole collection of people have made it what is today. Definitely, any modality which is being developed at one particular stage, advancement takes place. It is not the job of one, it is not the brainchild of one, it is many brains are involved in the developing this particular technology. How it works? Similarly, any imaging technology, the working principle remains the same. If any case on any talking about when talking about nuclear medicine, again we have to administer the isotopes. What is isotope? If you administer the isotope, it does not work because it goes and mixes with the blood pool. But our job is a tracer, radioactive tracer or radiopharmaceutical. It is injected in the living subject, usually in the blood. The tracer is chemically incorporated in the biological active molecule. Now, there is a waiting period while the active molecule becomes concentrated in tissues of interest. What does it mean, waiting period? Usually, if you go to a doctor and ask the PET scan to be done, or you might have seen the hospital where the PET scan is being done, the fluorodeoxyglucose labeled with F18 is administered to the patient. What exactly happens is, it is not the patient scanning starts then and there itself, but after the scanning is, before the scanning, the patient has to be kept waiting for 45 minutes. Why for 45 minutes? In order that activity is uniformly distributed so that you get a good quality image. And the patient has to be kept in rest, because during the movement of the patient, it may so happen the activity get concentrated in the muscles. So, information which you are looking for, you may not get into it. Again, as I am telling you, fluorodeoxyglucose, what is fluorodeoxyglucose? It is a kind of glucose. When it is labeled with a compound or labeled with an isotope fluorine, your cells which are very active and requires energy for their further work, which we do day in day out. In order to become the cells to be active, this glucose is required. Now, when the glucose is taken by the cells, cells won't understand whether it is sucrose, fructose or glucose or fluorodeoxyglucose. It takes up, energizes, the cell gets energized, and what happened? Because glycolysis takes place and whatever is remaining trapped in the cell is fluorine-18. Now, fluorine-18 is a positron emitter and that only it works. So, finally, fluorine-18 again comes out, moves a certain distance, annihilates with electrons and finally 2 gamma coming out. So, that is what is written, कि after travelling a few millimeter, this process takes place. So, what exactly, when this annihilation, 2 photons, again the principle, and that is what we are looking for. What we are looking for is 2 photons. They are detected when they reach to the scintillator in the scanning device, creating burst of light which is detected by photomultiplied tube. But again, I would like to clarify very important thing. Here detector is not the same as being used in SPECT, that is sodium iodide thallium activated crystals. Here detector is different. Detector is BGO, bismuth germanate oxalate, or LSO, lutetium oxo-orthosilicate, or GSO, gadolinium oxo-orthosilicate. Why these detectors are different? Because if you see the energy of the photons, which is 511 keV, your sodium iodide thallium activated crystal, if you want to use, you have to have very thick crystals. But here, if you see the sensitivity point of view, these detectors are more sensitive like BGO, GSO, LSO as compared to sodium iodide. And as a ring of detector is there. Here in this case, the two detectors or two heads are not there, but a ring of detector is there. So, in this way, the technician can create an image of the parts of a brain, for example, which is overactive. Let us see this particular PET scan. You can see the anatomical, physiological and superimposition. What does it mean? Anatomical image you can very well get from other imaging modalities like MRI, like CT, like X-ray. Why then PET is required? What for? Why this nuclear medicine has come forward? The reason is very simple, functional information. And if you can get the functional information at cellular level, it is very, very fruitful for our human mankind. You can able to diagnose this disease at very early stages, and definitely if you can able to diagnose the disease at very early stages, the treatment and the cure of the patient is well affected or well appreciated. Now, first image is which is being found as an anatomical image. This anatomical image has come from where? It has come from CT part. It has come from the unit which is attached with PET. Physiological image you are getting from the PET. Now, what exactly happened? The quality of image if you see from the CT part or MRI part is very good. You can able to resolve, you see the resolution, but the same quality or you can say clarity of the image is not there when you take the scan from the PET. But when you have to fuse it, because if you see these two images, first two images, you cannot able to find the disease stage, you cannot able to find the hot spot, you cannot find the problem where exactly it is located. The same can be done when you superimpose these two images. See PET application, CN here, how beautifully and clearly it shows over here. When the patient or the person is seeing the words, which particular part of the brain gets active. When you are hearing, which particular part of the brain gets active. Now see, when we are injecting fluorodeoxyglucose and we know all cells want energy, whichever cells are active in nature, they are going to absorb this fluorodeoxyglucose. And see the difference in the two images being created when the person is reading it or seeing the words and the person who is hearing the words. It so happens if a person is in tension and if you take an image, you can able to find out there is a problem, though it may be normal, because some of the brain's part get active. That is the reason whenever the scan is done, the patient has to be asked to remain not to remain active and sit quietly at one place, so that the whole body there is not be active area which gets which we can able to confuse by the cancerous cells next, which is not a cancerous but an active cells. Normal active cells which are more active can also absorb more fluoro-18. Now, if you see the uses of this PET scan, it can able to detect cancer. No doubt, cancer can be detected any part of time. But here detection of cancer means what? Here it means you can able to find the disease stages which is not possible in other modalities. And that is the reason if you see the PET CTs nowadays, most of the oncology departments where the cancer treatment is done, you can find the PET CT is there. It is very, very important as far as staging is concerned. It determines whether cancer has spread in the body or not. Sometimes whether the tumor is benign or malignant, that you can able to find out from there. It may so happen you can find the cancer at one place, but it has spread at many other places, which is possible to find it from PET CT only. Though lung may be a primary, but you are having metastasis, other spine, other lesions. Assess the effectiveness of treatment plans such as cancer therapy. Now, if a doctor can able to know where exactly is the cancer, he can able to plan the treatment. But if he can able to find the whole body PET CT that there are certain mets in the body apart from the primary tumors, there are some secondaries are there. So the type of treatment modality will change. Determine if a cancer returned after treatment or not. That is the reason staging is done. Once, before the PET CT, before the treatment of cancer starts, first the PET CT is done to know it, what exactly where is location, how big the cancer, and during the treatment, in between or after, it has been again scanned to find out whether it has been cured or still some part is remaining, or there are certain secondary which has been developed. Determine the blood flow to the heart muscles. Now, if you would like to know how much blood flow is in the heart muscle, how to find out without doing invasive techniques? This is one of the best important technique. By using positron emitter for heart scan, you can able to find out how much blood flow is there and sort of whether any blockage is there or not, you can find out. Determine the effect of heart attack or myocardial infarction or on areas of heart. Now, if a person has got a heart attack, if you want to know how much of heart is damaged, how much infarct has taken place, this is one of the best important technique to really come to know what is the place where heart attack has taken place and how much heart muscle has been damaged. Identify areas of heart muscle that would benefit from a procedure such as angioplasty or coronary artery bypass surgery in combination myocardial perfusion scan. Now, as I told you, and it is very well known that cardiologist still says that gold standard is angiography. But if you really go through this particular type of technique, you can able to find out, yeah, this is plays a very, very important role to come to know without doing any using invasive techniques. Evaluate brain abnormalities such as tumor, memory disorders, seizures and other central nervous system disorders. As I have shown you previous slide, where it clearly shows if a person is seeing the words or is in tension or in hearing mode, particular type of brains get activated. Then in this way you can very well able to find out, okay, whether patient is suffering from seizure or suffering from any kind of brain abnormalities, because again cellular level you are going to be able to treat, you are able to diagnose at cellular level to map normal human brain and heart functions. What are some of the uses of PET that we should know? Patient with condition affecting the brain, you can able to find out, as I am emphasizing on every slides, heart, certain types of cancer, Alzheimer's disease, some neurological disorder. Now, what is left out? You can have the application in cardiology, you can have the application neurology, you can have an application oncology and other type of disease. So, this is where there are certain uses of PET. Now, important thing is, we have talked about it is a positron emitter. We know that positron emitter is very good. Positron emitter finally annihilates, gives 2 photons, but how the positron comes out? Positron has been manufactured or produced from cyclotron, charged particle accelerator. Cyclotron is like any kind of accelerator because the function is to accelerate the charged particle, but it is circular in shape. It accelerates the charged particle. What type of charged particle? Either proton or deuteron, because they have some positive charges, they can be accelerated. Accelerated charged particle in a cycle path and these particles gain energy. So, accelerator itself means you are going to give the acceleration to the charged particle. Now, when energy particles then hit a target material and get absorbed into a nucleus, converting the target into a different species. That is the way we are getting a positron emitter. We talked about O18. When O18 is taken, it is being hit by proton. Finally, what exactly happens? You make a fluorine 18, PN reaction, neutron comes out. Proton hitting oxygen, making a fluorine 18. For example, a proton hydrogen when it hits O18 water, that converts into fluoride with the emission of neutron, other insignificant subatomic particle to balance the energy equilibrium. And definitely, whenever any reaction takes place, what exactly happens? This reaction gives what? It has to be balanced. Some types of neutron, when the neutron gets emitted, some types of energy also come out. And this is how to balance the particular reaction, which is taken place whenever the hitting takes place of proton to our target like O18 in this for production of F18. But we are not using positron directly. We need a tracer, because finally tracer works in order to know the disease place. Radioisotopes used in PET scan are isotopes of carbon, nitrogen, oxygen, gallium, fluorine 18 used as a substitute of hydrogen. The question arises, Why we are choosing a positron emitter? Our body is not made of technetium, thallium, gallium, which are the most commonly used isotope as far as conventional nuclear medicine is concerned. We are made of carbon, oxygen, nitrogen. So we have to look for an isotope which is constant part of human body. That is why these isotopes have been chosen, and they are very well good because they go and mix up the body in such a way as is the constant part of the body. Only radioactive form of natural elements that will pass safely through your body and be detected by the scanner. If you look for an isotope, which is not been produced or not a part of human body, then there are technetium, there are thallium, gallium are there, iodine. But when we talk about constant of the human body, we have to look for an isotope. Now isotope choice in case of this particular positron emission tomography is carbon, nitrogen, oxygen. Fluorine-18 is also one of the important choice because of its logistics and other reasons. The type of scanner used depends on what your doctor wants to measure. For example, if a doctor is looking at the tumor, he might use radio-labeled fluorodeoxyglucose and watch how it is metabolized by the tumor. It is tumor, we are talking about oncology, because again fluorodeoxyglucose is used. What does FDG does? FDG goes your cells which are active, and we all know tumor cells are more active than normal cells, because these tumor cells, they take all the glucose. They won't understand the glucose is coming from here, but the tracer is fluorine-18 here. This is gone inside the body, fluorine gets trapped, glucose glycolysis take place, it comes in the form of water, and this fluorine-18 emits the positron, and that is what we want to make the photons for detection purpose. See, if you see the clear picture over here, the two detectors around us, the same kind of detectors are there all around the body. The positron later annihilates the free electron, generates two photons. If you see the positron, how it is being annihilated with the electron and how these two photons are moving in the opposite direction. As and when or whenever this particular interaction takes place, photons are coming in two different directions. These gamma rays are used for medical imaging, and that is why it is called positron emission tomography. Detected using a coincident detection circuit. What is this coincident detection circuit? Coincident detection circuit is a type of circuitry so that you can able to detect two photons at the same time. If these two photons which are emitting from the point is not able to reach at the point of the where detection takes place in a particular time frame, the event is not detected. So there are some different type of events which we are going to discuss in next few slides, like true events, random events, etc. See how the PET events are taking place. True events very clearly says these two photons coming in opposite direction, hitting the target, and the event get detected. Scattered means what? See, you don't know, the photon which is being emitted from one part of the organ may not able to reach detector directly. It may come, it may hit some other organs, some bony particles or tissue particles, and get scattered. So it may so happen you are able to get a one event from the scattered and one the photon. It means the photon which is emitting in one place, it is going to one detector, but the photon at the other point is scattered and able to reach at other detector in the same time where the photon is coming. They are called scattered events. Similarly, random are there. Random is what? The event is not taking place because one photon, it reaches detector, it gets scattered, other is from other point. So in this way, the events are noted as a random, but they are not true events. It should not be detected and it should not be used for making the image reconstruction. Now when we talk about coincidence timing, as we discussed in the previous slide, there are three classes of events: true coincidence, scattered coincidence, and random coincidence. And if you see the sensitivity in PET, PET is more sensitive than SPECT because of many other reasons. Measuring capillary system detect truths and reject randoms. That is our objective, because if at all an image is being created from events which are coming from scattered or random, what exactly is happening? The thing is, the image is not in a good quality image because it creates a noise. So our main objective is how we can reject the scattered and random events which are also taking place behind or beside the true events. So, the more the true events are taking place, the more the good quality image is there. Now, why we have to combine PET and CT? It's very simple, because PET is what? It's an imaging modality which is used for functional purposes. What is the purpose of CT? The purpose of CT is to get a good anatomical images. Now, if we have two modalities together at one place, the patient does not have to go for CT separately and PET separately, and because of software we can able to combine these two scans. Earlier, this was the only thing which is being used. What we have to use, the patient has to go for CT, anatomical image is created, then the patient has been asked to go for PET if functional image is created, and in the software, or because of handshaking of two different software, what exactly happens? You are basically superimposing these two images and going to get a one good quality image. But here what exactly happens? The patient has to be scanned twice. It may so happen the patient is moved, whatever anatomy we are looking of, whatever the posture we are looking at, that may get disturbed. So, nowadays the technology which we are using is the combination technology PET and CT. Because the patient does not have to go for two examinations in one sitting rather than two different times if examination gets over. Now, CT parts, as we told, it is a high resolution anatomical information, and PET is low resolution functional imaging. Now, if you see high resolution, no doubt CT, MRI images you get good quality image, but PET images people do not like it because you will not understand, it is only functional part, because resolution is not that good. The traditional approach is what? Obtain CT and PET images separately, registration of CT and PET images to help interpretation of PET images. Either you have to register it separately, as I was discussing in the previous slide, or the mechanism has to be developed so that both things has to be fused together, the images taken at one point of time of PET and CT, and you get a good quality image. So, what exactly reason is, what is happening is you are making two registrations either separately, or in this case also the PET image has to be taken, the CT image to be, but the advantage is you are not moving the patient, you are registering the PET image first, CT image first, and finally you are combining these two images. See how the beautiful this picture looks, PET CT fusion. Now, if you can able to see a red, yellow and red point, which you cannot able to see if it was CT's part is taken, the patient may be have a problem, or CT may give some important thing, but you won't able to get a good location. That is possible when you are taking the PET images. When the PET and CT both fuse, see the images you get the clear indication where actually the disease is there. Now comes to the benefits of PET scan. The information provided by a nuclear medicine examination is unique and often unattainable using other imaging procedures. That is very clearly show the information what you are going to get from PET you may not get from any other examination. The functional MRIs have been tried. As far as anatomy is concerned, no doubt MRI and CT gives a good anatomical picture, but when we talk about PET, no comparison. For many diseases, nuclear medicine scans yields the most useful information needed to make a diagnosis or to determine appropriate treatment, if any. Nuclear medicine is less expensive and may yield more precise information than exploratory surgery. Very clear, because if at all you have to do invasive surgery, invasive techniques to find the disease or to treat the disease, nuclear medicine is less expensive. By identifying the changes in the body at the cellular level, PET imaging may detect the early onset disease before it is evident on other imaging tests such as CT or MRI. What is the advantage of PET is you can do the staging, you can able to find the disease at which stage it is, which is not in a position to find from CT or MRI. But there are certain limitations of PET scan. Time consuming. Why it takes time? It takes time because you have to inject activity, you have to ask the patient to wait for 45 minutes, and again 15-25 minutes for scanning, then acquisition and processing. The resolution of structure of the body with nuclear medicine may not be as clear as with other imaging techniques such as CT or MRI. PET scanning can give false results if chemical balances within the body are not normal. That is why it has been told, a function of the brain, if the brain is functioning too fast, you can able to get some information, may not be true, but may not be true, but that is the reason why we always ask the patient to sit quietly at one place, so that the absorption of the FDG is only for a cancerous cell, not for other kind of cell which gets active during kind of movement or during kind of thinking. Because the radioactive substance decays quickly and is effective for for only a short period of time, it is important for the patient to be on time for the appointment and to receive the radioactive material at the scheduled time. The reason the patient has to be there. In case of MRI CT scan, the patient can go at any time, can get the scan done, but which may not be possible in case of nuclear medicine examination and apart from PET CT, because the fluorine-18 which is required is a short half-life. If the fluorine-18 is not there in the department, scan cannot be done. So, if the fluorine-18 is already labeled with a compound, if the patient is not there, he is going to miss it. So, these are the limitations of the PET scan. A person who is very obese may not fit in the opening of a conventional PET CT unit, and this is very well true in case of other examinations also, like if a patient is obese, it may not go into the gantry because of his weight and other reasons. What are the benefits versus risk? Definitely any modality when we talk about, there are certain benefits and certain risk. Because PET allows study of body function, it can help physicians to detect alteration in biochemical process that suggest disease before changes in anatomy are apparent with other imaging tests such as CT or MRI. These are the benefits. Because the radioactivity is very short lived, your radiation exposure is low, the substance amount is so small that it does not affect the normal procedure or normal function of the body. PET imaging has been shown to improve detection out of variety of cameras, variety of cancers, and other tests have suggested this technique may be useful in identifying small tumors in patients with paraneoplastic neurological disorders. Again, the radioactive substance may expose radiation to the fetus in patients who are pregnant or the infants of women who are breastfeeding. The risk to the fetus or infant should be considered in relation to the potential information gained from the result of PET examination. If you are pregnant, you should inform the PET imaging staff before the examination is performed. Any of the nuclear medicine examination, if a woman is pregnant, then he or she has to inform to the staff before any radioactivity is administered, because it may have some kind of causes or risk to the fetus. Now, what are things to be considered? You will remain still for a long time. Definitely you have to wait for 45 minutes before the scan is to be carried out. Claustrophobia person may feel some anxiety because you have to be in the PET scan for a long time, for 25 minutes or 30 minutes, and you have to be placed. They may feel some kind of thing. Even though you may feel the desire to feel something due to the radioactivity, you will be disappointed unless they mistakenly inject you a plutonium gas. Usually we feel, when we take a normal crocin, we do not feel anything. But if someone says radioactivity is going to be administered, you started feeling that something is happening, though nothing happens until unless you are injected with plutonium gas. PET can give false results if the patient chemical levels are not normal, specifically test results of diabetic patients or patients who have eaten within a few hours prior to the examination can be adversely affected because of blood sugar or blood insulin levels. This is one of the limitations of PET scan. Also, because the radioactive substance decays quickly and is effective for a short period of time, it must be produced in a laboratory near the PET scanner. It is important to be on time for the appointment and to receive the radioactive substance at the scheduled time. PET must be done by a nuclear medicine physician who is specialized in nuclear medicine and has substantial experience with PET. Most large medical centers now have PET services available to their patients. Finally, the value of PET scan is enhanced when it is a part of larger diagnostic workup. This often entails comparison of PET scan with other imaging studies such as CT or MRI. In summary, in the presentation we say that PET produces images of the body by detecting the radiation emitted from the radioactive substance. These substances are injected into the body and are usually tagged with the radioactive atom like carbon, fluorine, oxygen, nitro. These are one of the 4 important positron emitter which is being used in nuclear medicine as far as molecular imaging is concerned, which has a short half-life. These radioactive atoms are formed by bombarding normal chemical with neutron to create a short-lived radioactive isotopes. PET detects and gamma is given off at the site where a positron emitted from the radioactive substance collides with electron in the tissue, and this result are evaluated by trained expert, which is a doctor and can able to diagnose the disease. Thank you.